The number one thing you need to be able to do right after your ACL surgery or any knee surgery is to be able to walk again. Today, I'm going to teach you how to get back your walking so that way you can go back to running and sprinting sooner than later. Let's get into that. All right, I'm Dr. Natty. I'm going to teach you guys how to get back your walking with these exercises. So the first thing we want to do is get your quads firing, because you need your quads in order to actually push into the ground and advance forward, right? So how we're going to do it, we're going to need a soft squishy ball or a soccer ball or a pillow, and you need to be against the wall. So what we're going to do, we are going to place the ball or pillow right behind the wall, and all we're going to do is slowly think about pushing your foot into the ground and push the back of your knee into the ball. So that way you can get to see nice quad contraction right there, right? We're going to hold that there for a few seconds. We're going to relax. And I want you guys to do this 10 times. So we're going to go 2, 3, 4, 5. As you're doing this, you should not feel any pain because you're actually using the muscle and you're not hanging by the front of the knee. 6, 7, 8, 9, 10. Once you have mastered that, I want you to hold the 10th rep, and then from there, we're gonna slowly, you can hang on to the wall, or you can get a stick like this or a crutch that you have. You're gonna hang on to this, you're gonna squeeze your quad, and you're gonna slowly lift this leg up, because that's how you would be doing when you're walking. So we're gonna do this 10 times. So you're gonna squeeze, and then lift. 2, 3, 4, 5. If you're doing this correctly, you should feel your hip firing, your quads firing. 6, 7, 8, 9, 10. And if you're having a hard time just doing these two, focus on just doing these for now until you can actually control it. Once you are able to do this, you're going to move on to the next one, where we're going to get rid of this. We're still going to use this for assistance, and we're just going to advance forward. So what you want to do is, again, squeeze your quads, squeeze your hips, lift this up, come back down, do the exact same thing. Now push down, lift this up, nice and slow, just like that. The one cue I like to give all my patients is you want to stay tall when you're coming up. You don't want to bend down. You want to keep that knee straight to get as tall as possible. And this is going to be very important when you're going back to running and sprinting. And we want to spend time doing around 5 minutes every single day, as much as you can throughout the day. And we're going to do that nonstop. Once you get better at that and you don't need the support from your crutches anymore, you're just going to do it on your own by just marching forward. Notice I stay tall, I look forward. Again, I want to do this for 5 minutes straight throughout the day. If you can do this, 5 times throughout the day, that's going to help you get your walking back. Awesome. If you guys just do these 3 and you stick to it every single day, I guarantee you'll be back to walking in no time, less than 3 weeks. Now I'm going to give you an advanced progression to teach you to walk better, to go back to running. All right, guys, on the next one, I lay out 3 different hurdles. Obviously, these are a little bit higher, so that means you have to really push into the ground, staying tall, and lifting up the leg to advance forward, right? So just like the marching, you're going to push into the ground, use your hips, use your quads, push, stay tall, advance forward, push, stay tall, advance forward, push, stay tall, advance forward. And again, I would do 5 minutes increment of this non-stop throughout the day, back and forth. And the slower, the better. Because what I've noticed, when the patients try to compensate, they try to go fast. So we want to go as slow as possible. So it's going to challenge your balance as well. Same thing here. On the way back, one thing I always focus on is looking straight, don't look down. So that's one of the advanced progression. Now the most advanced one, we're gonna use it to challenge your balance even more. So let's get into that one. Okay, so now you're gonna get a dowel or your crutch. To make it harder and more advanced, you're gonna bring it up overhead like so. So now you don't have your hands to help you balance. You're gonna keep pushing to the ground, look forward. And really focus on using your core and your hips to help you do this drill. Now, what's great about this one is that we actually use it as part of our sprinting warm-up. So you can do this really well. That means you're on a fast track to get back to sprinting even sooner. Again, really stay tall, reach up. Great. With all these exercises I gave you, I want you to practice every single day. Do as much and often as possible so that way you can get your walking back and you can go back to running and you're going to go back to sprinting. If you're new to this channel, please like, subscribe, and share this video. And if you already mastered this and you want to do more advanced stuff, check out our sprinting mechanics video right here or our plyometric video right over here to get you back on the field sooner. Hey, congratulations on taking the first step to taking care of your ACL rehab so you can get back to your sport faster than your peers. Now, because we're an expert at ACL rehab and we see ACL athletes in my clinic, we have an offer for you. We have an ACL course that you can sign up for. You can do all the stuff that we do here at home. So that way you can keep yourself accountable, get stronger, get faster, and have more confidence when you go back to your sport. So click the link below and then sign up for the course.